So I'll move on to Living Goods. So Living Goods is a pretty innovative charity. And the problem there, well, they're trying to solve two problems at once. So the first is essentially a distribution problem. And this is the fact that Living Goods estimate that there's about 270 million people in Africa who just absolutely lack access to products that we know improve health and can help improve lives and save lives. So this is kind of known as a last mile problem in public health, where we know what works and we know where the people are who need to get certain products, but there's a kind of distribution challenge to getting those products to the right people. And the second part of this problem is basically infant mortality and neonatal mortality. So each year, nearly 6 million children die under the age of 5, and more than half of these deaths could be prevented by simple and affordable interventions that we know work. So this is kind of a massive tragedy that so many children are dying from easily preventable illnesses. So what Living Goods do is they train and support a network of community health promoters. So these are typically women who are given a few weeks of basic healthcare training, and then they're given what Living Goods call a toolkit in a bag. So this is basically a bag with products worth about $30, but enough to serve about 800 people, of goods and products that we know improve health. So the way these women are motivated is this is essentially their job, and they keep about 15 to 20% of sales, but they sell these goods at very low prices compared to the kind of open market. But often it's actually the case that these goods just aren't available in these rural communities. So just to give you an example of the type of goods they sell, sometimes it'll be fortified foods, cooked stoves, or rehydration salts to prevent diarrhea, family planning, malaria treatments, solar lamps, and a bunch of other things. And Living Goods have been very explicit about the fact that they pair, so some of the goods in these women's bags will be kind of very low cost goods, which we know have a very high impact in kind of preventing deaths and improving health. So this might be malaria prevention or certain drugs or oral rehydration salts. But rather than just sell those goods, they also ask the women to sell what they call fast moving goods. And the idea here is this keeps the community health promoters motivated. It keeps them earning an income. And it allows these women to kind of keep earning a living while they travel from village to village in these very remote areas. So the main evidence of impact of Living Goods is a randomized controlled trial, which showed a 27% reduction in under 5 mortality and a 33% reduction in infant mortality. So this is a really huge result, really. The fact that Living Goods has done a very high quality study and shown that infant mortality reduces in the areas where they work is a really strong part of why we recommend them. So this main study kind of points to 3 mechanisms for how this reduction in mortality might be achieved. So one is an increased access to healthcare. So the study finds that there's a 71% increase in home visits to newborn babies in the first week, which is a very critical period in newborns' lives. Second is an improved health knowledge. So families are a lot more likely to understand the key causes of malaria and to kind of know what the key treatments for other easily preventable diseases like diarrhea are. And then the third kind of key mechanism is the fact that there's kind of healthy behavior change observed. So families are more likely to treat water before they drink it, and they're more likely to sleep under a bed net. So just to give a bit more on the program details here, so similar to Possible, rather than just focusing on one health intervention, Living Goods and Possible both try and take a more holistic approach. So here they've got a nice diagram where they say their integrated platform avoids the inefficiency of just focusing on one single issue health strategy. So they kind of provide family planning, malaria treatments, nutrition, clean stoves, and also kind of basic healthcare services, all through one program and one model. So yeah, this is kind of similar to the aspect of Possible, where they use community health workers and have this hub and spoke model. But Living Goods focuses exclusively on the kind of community health worker or community health promoter model. So yeah, these community health promoters serve this dual purpose of providing health products at a low cost and kind of educating communities on health issues. And they estimate that they're going to scale significantly. It's a very scalable program because these women kind of make a profit. It's very easy to kind of train new people and reach far more communities. So they estimate they'll have a coverage of about 25 million people by 2021. Okay, so let's move on to Project Healthy Children. So Project Healthy Children is our newest charity on the top picks. We added them earlier in 2018. And the problem they're trying to solve is that about 2 billion people in the world suffer from micronutrient deficiency. So this is basically deficiency in micronutrients that actually are pretty important for our health, but often we will get in a kind of varied diet in the West. And sometimes our foods will be fortified with these micronutrients. So most salts that you'll see sold in developed countries will actually be fortified with iodine. Okay, so the kind of four main micronutrients that they focus on are iodine, and iodine deficiency can result in intellectual disability. Vitamin A deficiency can lead to preventable blindness. Iron deficiency can lead to maternal mortality in childbirth, and a bunch of other kind of different morbidity conditions. And folic acid deficiency can lead to neural tube defects. So this is a fatal birth defect, which can also, if the child survives, can also have long-term developmental consequences for the child. So these micronutrients are very, very important for health. But a huge number of people, so 2 billion people, are deficient in them in the world. So Project Healthy Children tries to combat this micronutrient deficiency, and they have two main programs for doing this. The first is called ENACT monitoring, and this is their large-scale food fortification process. So the way they do this is they work with big plants that produce kind of staple foods like grains or wheat flour or maize flour, or kind of large producers of salt. And they work with these producers and local governments to enact a kind of micronutrient fortification program. So this program has reached over 31 million people in 15 countries, and it's extremely cost effective. So it costs less than 0.1 cents per person per year. Their second program is a small-scale food fortification program, and this is a program they call SANKU. So the reason they've shifted to provide this is because the large-scale food fortification programs typically reach urban populations, but they don't reach small communities where they're not buying their kind of staple foods from big producers. They're more likely to produce their staple foods more locally. So the small-scale food fortification program tries to reach these harder to reach communities. And the way they do this is they've developed this new technology, which they call a dosifier, which they basically put on top of a milling machine in village communities in rural areas of developing countries. And they provide some of the micronutrient mix, and this just allows these rural communities to fortify foods at very low cost in their own communities. They've also kind of expanded to serve refugee populations. This program was started last year in 2017 with the aim to kind of reach 1 million refugees by 2020. But this is currently quite a small program. So SANKU is their small-scale fortification program. There's a great video on this. I encourage you to watch this. It's embedded in the slides, but I'm not going to go through it now. But yeah, do take some time. It's about 3 minutes long and explains kind of how their small-scale dosifier works. So the evidence of impact here comes from a variety of studies. So GiveWell recommends vitamin A supplementation and salt iodization among its priority programs. They've recently done an evaluation on iron fortification as well, which looked very promising, but I'm not sure if they've released that yet. Copenhagen Consensus recommended a bundle of micronutrients and medicine as the most efficient intervention available when they did an evaluation of a bunch of different interventions in 2012. And GiveWell ranks Project Healthy Children as a standout charity. So just to kind of give you an idea of their scaling, so their large-scale program has reached 30 million people, or 31 million people. Their small-scale Sanku program is expected to reach an additional 20 million people by 2021. And you can see by this diagram on the right here that they're managing to successfully scale their program each year. And they've helped to achieve kind of national mandatory food fortification in a number of countries, including Zimbabwe, Burundi, Malawi, and Liberia. So yeah, they're scaling very well. They're having a big impact on people's lives through food fortification, and they're doing it at a very, very low cost. This is an extremely cost-effective program. Okay, so that's all I'm going to do on our top picks. Hopefully that was a good kind of short overview of each of our 5 top picks. And I just want to kind of talk you through some other resources here. So if you go to our website, you can learn a bit more about our charity selection process. There's a link here to some full slides which you can use on charity selection and on our current charities. And I think the best resource is 2-page overviews of each of our top picks, which is on our website. So just to see this, if you go to our website and if you go to the page on our charities, so if you click on charities and click on our charities, then you come to this page here. And if you scroll to any of our individual charities, if you click for more information, then it should give you a kind of 2 or 3-page overview of the research we do each year and the main reasons we recommend these charities. So yeah, I encourage you, if you want to learn more about these charities, that should probably be your first port of call. The other place to look would be GiveWell's website or the Life You Can Save's website, which I've also put links into here, and also Impact Matters.